Jump in to our webinar for this month, Fertility Treatments versus Junk Science. Thank you so much for joining us. So to kick us off, I'm going to introduce myself and then pass it to my co-host. My name is Jessica Ensley. I use she, her pronouns. I'm the Director of Digital Outreach here at ReproAction, and I will pass it over to Jasmine.
Thanks. I am Jasmine Gionzon. I use she, her pronouns, and I am the Senior Media Research Manager at ReproAction.
So here is an overview of our agenda. I'm going to introduce our organization, then I'll kick it over to Jasmine to take us through today's topic before we get into our panel discussion. And then we'll head on over to a couple of next steps and then Q&A. If folks have questions for our panelists as the webinar goes through, please feel free to enter those in and we'll address that at the end. So to introduce our organization, ReproAction, we lead bold action to increase access to abortion and advance reproductive justice. We are known for our left flank analysis, our willingness to hold folks on all sides accountable, whether they be allies or opposition, and our commitment to nonviolent direct action. And with that, I will pass it over to Jasmine.
Great. Thanks, Jessica. As we said, the topic at hand today is going to be fertility treatments versus junk science. So this slide is kind of just a level set so we can understand some key terms in terms of fertility treatments before we go ahead into debunking the junk science. So the most commonly used fertility treatments are intrauterine insemination, IUI or artificial insemination, and then also in vitro fertilization or IVF. And other mechanisms of fertility treatments that can also be used under IUI or IVF or on their own include ovary stimulation to induce ovulation through oral medication, third-party reproduction, which uses donated eggs, sperm, or embryos, or fertility awareness-based methods, FABMs, which can take multiple forms, such as using a calendar to track different phases of the menstrual cycle to discern what days a person is most fertile. And you might be aware of fertility awareness-based methods because some also use it as a form of contraception, but it can also be used in the fertility context. All right. And we can go a little bit deeper into IUI and IVF. So we have some definitions here from the American College of Obstetricians and Gynecologists. IUI consists of healthy sperm being placed into the uterus as close to the time of ovulation as possible. IUI can be used with ovulation stimulation, and the woman's partner or donor may provide the sperm. For in vitro fertilization, it is a multi-step process, beginning with removing eggs from the ovaries, fertilizing eggs with semen in a lab, and then transferring those embryos created in the process to the uterus. And now getting into the junk science part of it, one of the hottest topics right now among the conservative right is restorative reproductive medicine, which you also might hear as RM, NAPRO technology, neofertility, or integrated fertility. And we'll be using RRM in this webinar as shorthand. So RRM has been touted by abortion opponents as a cheaper and quote unquote more ethical alternative to IVF that seeks to address and treat what they call the root causes of fertility issues. However, medical authorities such as the American Medical Association, the AMA, and the College of Obstetricians and Gynecologists, or ACOG, have spoken out against restorative reproductive medicine, citing its lack of scientific backing and its false assertion that IVF inadequately addresses infertility. And the American Society for Reproductive Medicine has described RRM, saying it is an unscientific, politically motivated rejection of modern productive science. And to get a better picture of RRM and kind of what the opposition is saying about it, I have this slide here defining RRM in the opponent's words. So here we can see the definition created by the Heritage Foundation, whom you might know because of Project 2025. But if you don't, they are one of the largest think tanks on the political right, and they are a major proponent of RRM. And here they've defined RRM as a comprehensive approach to addressing the symptoms and causes of reproductive dysfunction. And rather than treating reproductive or bodily dysfunction in a piecemeal manner, RM examines the whole body and the multitude of conditions or comorbidities that may contribute to the symptoms patients experience. And some examples of what might be under the RM umbrella from the Heritage Foundation include cycle tracking, targeted lab tests, lifestyle interventions, medical and hormonal therapies, and corrective surgeries to restore natural fertility. Okay, and so now that we have this definition of RRM, we want to go into why it is problematic. So ironically, many of the so-called holistic RRM methods activists frame as novel, such as improving nutrition or addressing hormone imbalances, or some of the other methods used on the last slide, are actually already used in the same conventional fertility methods condemned by anti-abortion movement, but are given a different name. And in other cases, RM can expose patients to unnecessary medical interventions and delay the time it takes to get pregnant. And while the introduction of RM into the public might come off as well-meaning as a way to address infertility, the reality is that the public promotion of RM is only happening in service of the anti-abortion activists' plan to ban IVF access. And you might be wondering why anti-abortion leaders are so against IVF and are pushing RM instead, especially considering that many anti-abortion leaders are like explicitly pro-natalist and have talked about how and have advocated for the growth of families in the US population. But RM is actually just one pawn in the anti-abortion movement's goal of codifying the concept of fetal personhood, which would confer legal rights to unborn fetuses under the Equal Protection Clause of the 14th Amendment. And it's just another pawn in the long-term goal of the anti-abortion movement to abolish abortion. The legal concept of fetal personhood has been expanded in the modern world to now include embryos. So, in the process of IVF, there are typically more embryos created than are used in case some embryos are not viable. And the destruction of these embryos is equated to murder under this ideology. And adding fetal personhood language to legislation opens the door for bad actors to criminalize abortion, miscarriage, and IVF treatments and gives way for the prosecution of pregnant people. So even just this push to ban IVF, even though it might seem niche and weird on the onset, it can be used for a host of things like criminalizing abortion, miscarriage, etc. All right, and I wanted to go over some policies regarding IVF and RM. We all know that the Trump administration has kind of a weird relationship with the anti-abortion movement in terms of having on and off periods of him wanting to publicly promote the anti-abortion movement versus him backing away from the anti-abortion movement. And one thing that actually made the anti-abortion movement very upset was during the 2024 presidential campaign. Trump had proclaimed himself as the father of IVF at a women's conference, by the way, and this was in October of 2024. And then the two bottom headlines are from 2025, and we can kind of see how the anti-abortion movement has influenced the Trump administration. So here it says the anti-abortion groups lobbied Trump against IVF, and they say they're winning. A lot of anti-abortion leaders have, bragged about informing members of the White House about the so-called dangers of IVF, and try to change the mind of the administration and back off from their previous pledges. And then Because of this anti-abortion campaign, the White House has essentially backed off from its normal promise of um, advocating for free IVF care, saying it has no plan to mandate IVF care, despite Trump's previous campaign pledge. And here are some more policies about RRM and its promotion federally. So in 2025, there were two bills um, introduced, the Reproductive Empowerment and Support Through Optimal Restoration Act of 2025, also known as the Restore Act, was introduced in the Senate by Cindy Hyde-Smith of Mississippi and James Lankford of Oklahoma, and in the House by Dana Harshberger in Tennessee and Riley Moore of West Virginia. And essentially, this bill would aim to allocate federal funding to expand research and provide training opportunities on RM to healthcare professionals. And actually, a lot of the language of the Restore Act is derived from model legislation from the Heritage Foundation and from the Ethics and Public Policy Center, which is also a research slash think tank in the anti-abortion space that is vehemently against IVF and very much pro RM. And lastly, here we can see that Robert F. Kennedy's Department of Health and Human Services announced a $1.5 million grant to build an infertility training center to teach RM to more practitioners. So we can see that the Trump administration is like investing actual money into RM. So I don't think this problem is going away anytime soon. And I'll pass it back to you, Jessica.
Great. Thank you, Jasmine, for that overview. It's very informative and helpful. With that, we're gonna start our panel section. So it is my pleasure to introduce our first panelist, Maddie Angelic. Maddie, she, they is youth organizer, abortion doula, and emergency contraceptive access organizer in DC. She currently serves as organizing and engagement specialist for campuses and workshops at Catholics for Choice, where she works with young people to build power and community through the Young Catholic Repro Collective and supports students organizing for reproductive justice on Catholic campuses. Maddie, thank you so much for joining us today.
Thank you so much for having me.
Of course. My first question for you is last year you released a statement on the USCCB's attack on IVF. Can you walk us through that response and how your background shaped the work that you do for reproductive care at Catholics for Choice?
Absolutely. Thank you so much for this question, Jessica. But last year, when I saw the bishop's statement, I knew that I wanted to say something to dispel the really harmful claims that the bishops were making around the harms of IVF. And in part, that is because I was raised knowing that my brother and I were the proud result of IVF when my parents had difficulty conceiving. And I was raised by my parents knowing that this was a part of God's plan and that we were God's gift. And that really was in contrast to what the bishops were saying about the harms of IVF, and especially the ways that they talked about it, quote unquote, destroying human life. And then today, as someone who works at CFC and is a reproductive justice organizer, I know that my parents are right, that IVF is one of God's many gifts, no matter what the bishops say. And as a Catholic person who supports reproductive freedom, I believe all people must be able to make conscience-based decisions about their bodies, lives, and futures, and not just in spite of my faith, but because of it. I also was raised in a very progressive Catholic community, and I assume that these values around social justice clearly must also apply to queer liberation and reproductive freedom. And so when I learned that they didn't, I really felt that disconnect between what the values of the church were, and what I was hearing in my community and some of the values that I held and the ways that I saw them connected to social justice. I also knew that my parents obviously had chosen IVF and had followed their conscience in doing so. And this taught me from a really young age that Catholics can, in good faith, disagree with the institutional positions of the church. So later, when I came out as lesbian and started using contraception, I had this example of what it looks like to faithfully disagree with the church and to follow your own conscience. And that's part of why I think it's so important to be public about my story related to IVF, and why I encourage other Catholic people to share their stories about reproductive health care, because it so powerfully dismantles this idea that you can't be Catholic and support reproductive health care, and also then reclaims our bodily autonomy from the institutional Catholic Church. I really just want other Catholics to know they're not alone when deciding if, when, and how to grow their families, whether that involves choosing IVF, abortion, contraception, or other reproductive medicine. And now, as a queer person, IVF also has a new importance to me since LGBTQIA plus people disproportionately rely on it to grow their families. And we really see with like what Jasmine said around RRM, some of these attacks and what's baked into this junk science is around excluding LGBTQIA plus people from fertility treatments and from fertility medicine, because the anti-abortion opponents are allied with anti-LGBTQIA plus causes, and don't want to see queer people grow their families. Um, and so, like many of the other areas of reproductive health care, the question of who can access fertility care is really important and something that continually needs our attention as repro organizers. And it also means that when we're fighting for IVF, it's important to make sure that we're not leaving queer people behind. But today, this is really still such a grounding of my work and really important because all of the church's positions on repro and gender is really tied together, as Jasmine was saying about how attacks on IVF are related to fetal personhood and abortion and contraception access. We kind of see that all of these issues are kind of rooted in the same views of sex and the patriarchal desire of the church to control women and gender nonconforming folks. So that's kind of why I felt like I wanted to respond to the bishop's statement and why I still feel like it's a really important part of my organizing today.
Great. Thank you so much for um, sharing all of that and also some of your background. I think it's really important for us to discuss the ways in which we all grew up impacting how we fight for reproductive care. So thank you so much for sharing that. My next question for you, and you touched on this a little bit, is in what ways do you think the condemnation of IVF as an official position of the United States Conference of Catholic Bishops adds additionally to the stigma already facing fertility treatments?
Yeah, I think this is such a great question because it adds so much. I think like growing up and knowing that I was the result of IVF led me to really be like attuned to the stigma against IVF that I was seeing in the church, and the USCCB, and the ways that it kind of creates silence for folks around not wanting to talk about this, and also just some of the other harmful messages, both to people who choose IVF and people who are the result of IVF around the stigma there. But one thing that I think really sticks with me when I think about the stigma of IVF is something that my mom actually told me at one point about her experience with IVF and the church of stigma, which is just how painful it is for the church to tell women their whole lives that their main role is to be mothers, and then at the same time tell them that using fertility treatments and IVF is sinful. And I think it's like that kind of gets to a lot of the ways that the church's position and the stigma there is so harmful to people, because it really just like attacks one of the ways that people can choose to have families, and often one of the only ways that people can choose to have families when they're facing infertility. Um, and I think that there also is like a lot to unpack there and important work to be done to also tackle the church's messaging about gender complementarity and the role of women. But as someone who is really striving toward the reproductive justice framework in my organizing, which also includes the human right of people to have the children they want to have, I know that for many Catholic people who want to be parents, the stigma around IVF is causing a lot of harm to them. But also, we don't just hear these stigmatizing messages in pulpit. They're not just like in one church, in one place. They're really broadcast in pulpits around the world. And the church has so many other institutional places that we see this message kind of having really sticking power. The first is like hearing these messages about fertility treatments, such as IVF, being wrong from the pulpit. Not only means that people are hearing stigma, but also amplifies it because it carries with it moral and religious weight. So, like hearing not only these messages, but hearing them from people that that are spiritually important to you is really damaging to folks. Also, for many Catholic people, their churches are one of their main sources of community. And the church's position means that this community is often not somewhere that people feel comfortable going to when they are experiencing fertility issues, which can leave people to feeling really alone and isolated. This is something that people often want to be able to rely on their community around. And if you feel like you can't be a part of your church community during these periods, it can be really difficult. And then also, stigma overall just encourages us to feel alone and isolated and stay silent because if we talk about it, we would learn that lots of other people think the same things we do and have gone through the same thing, including many people in our faith communities. So we see the stigma kind of continuing this cycle of silence in the church and among people who choose IVF in the church, which is a lot more people than anyone would think. But the church is also one of the most powerful bodies in the world and institutionalizes the stigma. As we are all experiencing in the current day, the church extends its stigma to reproductive health policy. So, like when it comes to the Supreme Court, all of the justices who overturned Roe were Catholic or raised Catholic. At an international level, through the Vatican City and the Holy See's non-member observer state status, the Catholic Church is the only religion that is a part of the United Nations. And also, the stigma impacts the availability of healthcare because Catholic healthcare institutions have to follow the positions of the church through the ethical and religious directives, which impact healthcare at Catholic facilities, which represent 1 in 6 hospital beds in the country. So not only do we see the stigma harming people because of all of the ways that we see stigma harm folks, but also the church does a lot of work to institutionalize the stigma and control what access people do and don't have, whether they're Catholic or not.
Absolutely. Thank you so much for walking us through how the Catholic Church as an institution can lead to stigma, and then all of the other facets that are around it for folks that impact people on a daily basis and throughout their daily lives. So with that, my last question for you now is, what advice would you have for people who are dealing with a situation of wanting to grow their family, but are getting all those external messages that what they want and how they can achieve growing their family through IVF and other fertility methods is at odds with their religious beliefs?
Yeah. So as an abortion doula, I feel like that experience of supporting people of faith and making reproductive health decisions always is like what comes up for me, even beyond the context of abortion when folks ask about supporting people of faith. But the first thing I always do is remind people that they're not alone. Religious stigma around fertility treatments functions to make us all think that we're the only religious person who is facing the situation or the only religious person who would choose insert type of reproductive health care. And that's simply not true. Every day, people of faith follow their conscience to make decisions to grow their families using reproductive medicine. And that's really important for folks to realize that they're not the and you also don't have to take my word for it. There are many Catholic people and other people of faith who have shared their stories about using reproductive medicine to grow their families. And I always encourage folks to uh, lean on some of the stories of folks who've chosen this. I think it can be really helpful and healing for folks. And we have a whole bunch of stories in on our website at catholicsforchoice.org, where folks can read about Catholics making all sorts of reproductive health decisions and why Catholics support reproductive freedom. And I also encourage people to talk about their own reproductive health stories when they feel ready, and maybe even share their story publicly. First, people would really be shocked to see what they find, because cultural messages tell us that the majority of Catholic people don't support reproductive freedom when we know that's not true. So they might find more folks in their community than they thought. And also, sharing stories is so powerful, not only to deconstruct the stigma for others, but I think it also does a lot of work to tell ourselves that we can be fully ourselves and we don't have to like hide things or have this secret. And then I also draw upon the Catholic teaching of conscience, I think is really important for folks in this situation. So in Catholic teaching, conscience is the final arbiter in any moral decision we make. It's even in the Catechism, which teaches us that in all we say and do, we are obliged to follow faithfully what we know to be just and right. So conscience is not just formed by the hierarchy's teaching and a weapon for institutions to impose their beliefs on others, but is also something cultivated ourselves through prayer, education, reflection, and being in community with others. And so I think this is really important to just for folks to have in mind that there is room to disagree with the church in Catholic tradition. And if you are doing what you know to be just and right and the best decision for you and your family and your community, then you are acting in good conscience. And I think just reminding folks of that message of conscience from our Catholic teaching can be helpful for people.
Absolutely. Thank you so much for that. If for one, sharing your story and also uplifting how important storytelling can be when trying to break down any sort of stigma with reproductive health care, because all of these methods, from IVF to contraception to abortion to generalized checkups, are incredibly common and needed and useful, and there is no shame in them. So thank you so much, Maddie. We I look forward to hearing from you more at the Q&A section. With that, I'm going to kick it over to Jasmine to introduce our next panelist.
Thank you. Our next panelist is Joy Dugan. Joy uses she, her pronouns and is a human rights counsel at the Center for Reproductive Rights, where she focuses on the center's U.S. work on assisted reproduction. Using a human rights framework, Joy focuses in large part on state legislative advocacy to promote equitable access to fertility care, including IVF, and the rights of all parties to surrogacy agreements, in particular, the rights of persons who act as surrogates. As part of her state work, Joy also focuses on defending against attacks on IVF and ensuring people have the right and meaningful access to the fertility care they need to build their families. Prior to joining the center, Joy was a public defender in both the family defense practice and criminal defense practice at Brooklyn Defender Services and practiced international human rights as a global legal advisor at Equality Now. Joy received her BA in Human Rights and Psychology from Barnard College, her JD from Fordham Law School, and joined the center in 2022. So thank you, Joy, for joining us. So the first question, we really wanted to lean on your legal expertise here. Can you describe for us how the legal landscape on fertility treatment, especially IVF, has changed since the February 2024 Alabama Supreme Court ruling that legally equated frozen embryos to children?
Sure. Thank you so much for having me and for that question, Jasmine. Yeah, so jumping right in, since the Alabama Supreme Court ruling, we've seen some positive actions, such as a handful of states enacting right to IVF laws, which, while they fall short of providing meaningful access to IVF, for example, through providing insurance coverage, these types of laws are a step in the right direction. But, since then, we've also seen an increase in laws that aim to grant embryos legal rights. Jasmine, you touched on this. These are laws that are commonly referred to as embryo personhood laws. And we've also seen a wave of other legislative attacks on IVF. And this is really where I want to focus my answer on today because, as you mentioned, we are seeing an increase in the legal landscape on attacks on IVF. So the first attack that we're seeing and we expect to see more of is what we call restrictive IVF laws. Restrictive IVF laws, which its proponents refer to often as ethical IVF. So you might hear ethical IVF is really anything but ethical. These laws are premised on the idea that embryos should have legal rights, that essentially trump the rights of pregnant people, resulting in restrictions that require patients to take on more of a financial, emotional, and physical burden, and making an already daunting process not even more expensive, but also less effective. So these types of laws that we're seeing are ones that impose limits on the number of embryos created per cycle. So, example, mandating that only one embryo be created per cycle. They prohibit embryo cryopreservation or the freezing of embryos. They might prohibit genetic screening of embryos. They might require patients to put their embryos up for quote unquote adoption. So, really using that personhood language, as well as limiting IVF access to straight heterosexual married couples, which we know excludes so many people who need fertility care to build their families. And the impact of these laws is really that, it undermines IVF's medical standard of care, which for one is to create as many embryos as possible per cycle to give patients the best chance of becoming pregnant and having a baby. They also force patients to undergo more cycles than are necessary. And again, that puts folks' bodies through an already arduous regimen. And by making IVS less effective, because we're not practicing the normal standard of care, patients will undoubtedly incur higher out-of-pocket costs because they're being needing to turn to additional cycles, which just puts fertility care out of reach for so many who cannot afford those out-of-pocket costs. And as well, there are potential risks that, require patients to face the decision of either having to transfer all the embryos that were created in a cycle at once, which could lead to a multiple pregnancy, which carries its own additional health risks, or be faced with the decision to either put up, quote unquote, excess embryos up for quote unquote adoption. Um, and as I mentioned, and I think, Maddie touched on a bit, these types of laws exclude single individuals, same-sex couples, couples who are in the LGBT community or not, who might need to use donor gametes, donor embryos, people who need to use a surrogate. So all people who need to build their families, in using fertility care, these folks are really excluded from the conversation. Um, Another really big attack on IVF that you touched on, Jasmine, but just want to add some more, I guess, color to the conversation is around restorative reproductive medicine, RRM, which, really should just be called blame and shame fertility care. Uh, RRM proponents claim to quote unquote fix or restore women's fertility using methods that are not the standard of care for treating infertility. Rather, RRM proponents seek to redefine what fertility healthcare is and to essentially deter or delay people from accessing the full spectrum of fertility healthcare, including IVF. And because fertility healthcare is really time sensitive, delaying access to the full spectrum of fertility healthcare, including IVF, really can compromise people's ability to grow their families. And while many people's fertility healthcare experiences and processes already incorporate holistic methods, including ovulation tracking and homeopathic treatments, which is great, right? There's no problem with that. That's a wonderful thing to incorporate into one's fertility process. The issue with RRM is that it positions these methods against IVF rather than as complementary, and it promotes quote unquote more natural ways. Think like, make America healthy again narrative, right? It promotes these quote unquote natural ways to address infertility while disparaging those who use modern reproductive technologies like IVF. And it also assumes that infertility really is the pregnant person's fault. They use very gendered language, so they really hit home that it's the woman's fault. But they posit infertility as the pregnant person's fault based on either their diet, lifestyle, age, and that the need to use IVF is a personal failure. And all in all, both restrictive IVF, RRM, really what they're doing too is just promoting, and Maddie touched on this, a really narrow vision of family, including what family looks like, how families are created, and does nothing to promote access to fertility health care for single individuals and LGBTQ couples for whom IVF is a critical method of family building. RRM poses barriers to access IVF by either requiring people to use RRM or, fertility awareness-based methods before even being able to try IVF. So again, delaying access to care. Um, and, laws, we've seen already that laws have been introduced, this session included, that would both allow providers, we're seeing some laws being written that allow providers to not only refuse to train, provide, or refer patients to assisted reproduction technology such as IVF due to their religious or moral objections, while at the same time requiring public health programs like Title 10 to incorporate RRM into their programs, drawing funds from their already limited budget to do so. I could go on and on about some of the legal attacks that we're seeing, but those are two that I really want to uplift. And also, if you want to learn more about some of the other legal attacks, they're on the center's website under a page called IVF Under Attack. And we can also try to find a way to circulate the center's publication on that. But yeah, so unfortunately, as Jasmine, you mentioned, we don't see kind of these attacks on IVF going away anytime soon. We have definitely seen an increase since Alabama.
Wow, thank you for such an expansive answer. There's truly just so much going on the legal landscape on so many different fronts. I really appreciated how you reframed restorative reproductive medicine as blame and shame fertility, and how you mentioned like the use of ethical IVF is just so subversive, really just counterintuitive to what practices abortion opponents are actually promoting. So moving on, I just wanted to ask, what kind of legal dangers could the codification of embryo personhood create?
Yeah, so you touched a bit on it, I think, Jasmine, but yeah, so embryo personhood laws, these are laws that include language or definitions in them that define essentially life beginning at the moment of fertilization, or sometimes you'll see quote unquote laws that define life at the beginning or the fusion of egg and sperm. These are generally what we refer to as embryo personhood laws. And embryo personhood laws, while not they aren't automatically an outright ban on IVF just by having these definitions. We do know and see that these laws make IVF harder, if not impossible to access. And that's because, if we treat an IVF embryo, and not even an embryo sometimes, right? Depending on what stage of development the cells are, right? We're really talking about a zygote or blastocyst, but again, junk science. So if we're referring to IVF embryos as humans, these laws essentially would prohibit people from being able to dispose of their embryos, or make decisions about them, what to do with any embryos that they're not planning to use, and thus really forcing them to pay an indefinite storage cost to keep them cryopreserved. And storage costs come at a really high out-of-pocket cost. Uh, Embryo personhood laws also can have implications for healthcare providers or even lab technicians, those who are creating embryos and handling them as just the standard practice of providing IVF. So there are really some legal ramifications that are concerning when it comes to anything that happens to an IVF embryo once we decide to grant IVF embryos legal rights. And of course, starting personhood at the IVF embryo stage implicates fetal personhood. And the harms of recognizing a fetus as a legal person we know are severe, and they include undermining people's reproductive autonomy and health, banning abortion, criminalizing pregnant people for their behavior while pregnant, and criminalizing pregnant people for pregnancy loss. So, yes, IVF embryo personhood or embryo personhood has many legal dangerous ramifications, Jasmine. Thanks for the question.
Yeah, thank you for your answer. It was really helpful for you to really parse out how these legal dangers apply not only to people who are seeking out fertility treatments, specifically IVF, but also the practitioners and the providers of these healthcare services, and how these people might be legally targeted, even for just performing their job and providing care for their patients. Lastly, I wanted to just ask you, could you describe the different barriers to accessing fertility care that exist for marginalized communities?
Sure, yeah. So, the barriers that many people face already to accessing fertility care, of course, disproportionately impacts marginalized communities from accessing this care. And these barriers include, I'll start with, lack of or limited insurance coverage. IVF insurance coverage is limited across the country, and even where it exists, it can be discriminatory. Um, and a lot of people like to say, fertility care in and of itself is really expensive. But if you think about it, a knee replacement is expensive, but there's health care insurance coverage for that. So fertility care is just like any other health care. We should have insurance coverage for folks to get it. But currently, only 21 states and Washington, D.C. mandate some degree of private insurance coverage for fertility care. And of those that mandate insurance coverage, uh, some of these mandates include discriminatory eligibility requirements in the laws. So they exclude non-married individuals, they exclude same-sex couples, they exclude individuals or couples who may need to use donor gametes. Um, these mandates often also apply only to certain types of private insurance. So if you're in a state that has an insurance mandate, but you don't have the type of insurance plan that is required to cover fertility care, you're often out of luck. None of these insurance mandates apply to self-insured employers. And oftentimes there are religious employer exemptions baked into the laws. And perhaps most notably, there are no states that provide comprehensive IVF coverage to those on Medicaid, which we know disproportionately impacts people living on low incomes, people with disabilities, and Black, Indigenous, and other people of color. So that's one major barrier that we have. And then another is stigma and bias. You heard Maddie talk about religious stigma. Just stigma and bias is baked into the healthcare system, and infertility is no exception. So infertility is often highly stigmatized, and a person, who's struggling to become pregnant may not even feel comfortable talking to their providers about it. Or if they do talk to their providers about it, they might face bias from their providers who hold certain stereotypes or negative preconceptions about who can and who should be able to parent. And we know that these barriers lead to disproportionately low rates of IVF access for Black, Indigenous, and other people of color, people living on low incomes, people with disabilities, people with high body mass index, and the LGBTQ community. And finally, the last barrier we touched on a bit is we see more and more state laws limiting access. So, following the U.S. Supreme Court's decision on Dobbs versus Women's Health Center, we've seen an increase in states rolling back access to IVF. There are these attacks called TRIP bills, which we didn't really get into, but if you know targeted restrictions of IVF providers, TRIP bills, they mimic the anti-abortion context of TRAP bills that single out IVF providers unnecessarily with burdensome licensing schemes. All of these restrictions and the ones that I mentioned earlier just lead to the possibility of more clinics and providers closing and contributing to healthcare deserts and leaving people without access to quality IVF care where they are, which we know particularly impacts those most marginalized. So really, it's a combination of lack of insurance, stigma and bias, and states limiting access to IVF care that, present barriers that disproportionately impact marginalized communities.
Amazing. Thank you for your answer on that, and being able to share how so many different kinds of marginalized communities are affected by these restrictions on IVF and the attempt to codify embryo personhood. And I really appreciate your bringing up of stigma with Maddie as well. And I'm glad that we get to have this conversation today to try and dissuade people from keeping quiet about IVF, and really just open the conversation and let people know that IVF is normal and they shouldn't feel awful for doing something that is normal and perfectly ethical. And I will pass it to Jessica for our final panelist.
Great. Thank you, Jory, and thank you, Jasmine. It's my pleasure to introduce our next panelist. And again, if you have questions for any of the folks speaking today, please enter them in the Q&A section. We'll get to them at the end. And with that, I will introduce Gina Arias. She, her pronouns is the campaign director for maternal mental health at Moms Rising. In this role, she advocates for policy changes and greater resources for maternal mental health, as well as leads the organization's reproductive justice work. She has over 25 years of experience in public health focused on program management, community engagement, partnership building, training, and policy and advocacy. She is a registered nurse and holds a Master of Public Health degree from Columbia University. She's also the co-creator of Excursions with Gina Arias, a storytelling podcast focused on the themes of community, music, and resistance. And last but not least, she is the mother of a 24-year-old son who is her pride and joy. And if you're hearing background noise, I'm going to apologize. My dog has decided now to finish her breakfast. So I'm going to quickly pass it over to Gina with my first question, which is the Trump administration often describes itself as pro-family and has introduced policy initiatives to boost the country's birth rate. Where does this conservative obsession with pro-natalist rhetoric stem from, and in what ways is that rhetoric harmful?
Well, let me start by stating emphatically that this rhetoric and the policies that have stemmed from it are and always have been undeniably anti-family. So we know that the Trump regime proves this every day by attacking supports that help families thrive. For example, they oppose childcare subsidies, they cut food and nutrition assistance and Medicaid, and this country continues to be the only industrialized country in the world without a national paid family leave policy. And that's just, to name a few. So protecting and supporting families is not at all what they're interested in doing. And at Moms Rising, we understand this obsession and the harmful policies that follow it to actually be rooted in their desire to control reproductive freedom and bodily autonomy, which we've heard from the other panelists as well. And if I could, we mentioned the Alabama Supreme Court ruling, but I just want to hold that up again as one example of the Republican anti-abortion zealotry. That was at the core of this very dangerous ruling 2 years ago that Jory spoke about, that under state law, frozen embryos are considered children. I mean, I want that to really sink in, right? That means that living, breathing children and frozen embryos are protected equally under the state's, laws. And I would like to share a story briefly from a Moms Rising member who used IVF to build her family. This is from Kristen in Georgia. She said, IVF was critical to our family building. Our two beautiful children would not exist without access. Embryos and blastocysts are a wonderful possibility, but they're not children. They're a hope for the future, and this ruling will inhibit access for so many hopeful families and their reproductive medical support teams. Alabama's ruling will result in less children, not more. So, there is an irony to them calling themselves pro-family. And we know that following the ruling, we had IVF providers in Alabama that put a pause on the services, and that threw families under their care, of course, into chaos and uncertainty. And then a couple of weeks later, when the state was confronted with the righteous public outrage, the state legislature passed a bill, providing immunity to clinics and the people who access the care. But the law does absolutely nothing to change the fact that, again, the state now considers embryos to be unborn children with equal protection under state law. And as Jory mentioned, this has major implications for the health and well-being of families, not just for fertility treatments, but also for abortion rights, contraception, and the rights of pregnant women, and pregnant people. Imagine a pregnant person has a sip of wine or fails to wear a seatbelt or in some other way is judged to have harmed the fetus. The consequences could be very serious, especially considering that currently we have 17 states that have established fetal rights by law or judicial decision to apply to either criminal law or both criminal and civil laws. So, we should be clear that Trump is not the quote father of IVF, but he is the architect of this dystopian nightmare that we're dealing with right now.
Thank you so much for walking us through that. I think that's really important to keep in mind all of the ways this country and conservative policies are already failing families. And I think it's really important to keep in mind as we're looking at a landscape that's getting even harder. My next question for you is, can you explain how the Trump policies surrounding fertility care really fall short of any sort of previous campaign promises?
Yeah, well, during the campaign, he promised to make IVF free. And I guess in October it was, he signed an executive order. And what that actually does is offer a discount on certain drugs that are used in IVF treatments, and it develops options for employers to voluntarily offer assistance with fertility costs. Voluntarily, meaning that employers are under no obligation to change anything at all. So there is no mandate. So, it also means that uninsured people, of which there are over 26 million in this country, low-income people, people without health insurance from an employer that opts to cover IVF, will not benefit at all. So this is quite a far cry from free IVF. And again, the truth is, supporting families really is not the focus of the Republican Party. Tina Sherman, who is the National Director of Maternal Justice here at Moms Rising, wrote a piece last year in an op-ed in Ms. Magazine, and she says they offer lip service, but their words are empty and their positions disgraceful. So we stand by that. And the fact of the matter is that the U.S. Supreme Court ruling that overturned Roe v. Wade really has unleashed a Pandora's box of horrors that seem endless. Women have lost access to reproductive health care, including abortion, despite the fact that most people in this country support abortion access. Clinics that also provide contraception and cancer screenings, STD testing and treatment, and a host of other services have been forced to close. Most notably, of course, Planned Parenthood, which is our nation's largest provider of low-cost sexual and reproductive health services. They've been forced to close 23 health centers since a federal law blocked millions of patients from using their Medicaid insurance at Planned Parenthood health centers. Besides that, we have hospitals telling people with non-viable pregnancies to wait in parking lots until their conditions become critical. And just recently in Florida, we heard about two women who were mandated by judges while in active labor and forced to have C-sections against their will. We know that women are being denied medications that they've long taken and need because those meds can result in abortion. We have that woman in Ohio who was prosecuted, and I'm sure others, after having a miscarriage for not disposing of the remains properly. Luckily, in that case, the grand jury declined to bring charges against her. But, we know medication abortion is under attack. We have several states that are threatening to ban travel to get abortion care, and some counties in Texas, for example, already have those bans in place. And now, we have imperiled access to IVF care that's been added to that list of horrors. But, we should be really clear. It didn't end with abortion, and it won't end with IVF.
Absolutely. So right on that. And an expansion upon it, if anyone is interested, is a previous webinar that we have done on our website talking about coming for that conservatives are coming for your contraception. So yeah, this conversation is not happening in a vacuum. All of these issues are interspersed, and attack on any reproductive health care or any sort of bodily autonomy is slowly eroding access for a lot of different people in a lot of different communities and a lot of different procedures. So with that and knowing sort of the rough situation we are in nationwide, what are some policy actions that would improve the quality of life and the awful maternal and infant mortality rate that we have in this country to help families?
Well, so many, but I'll just say, I'll talk about a few. And I'd like to start with paid family and medical leave. We know that paid family leave has been shown to reduce infant mortality by as much as 20%. And the US ranks uh, 37 of all countries in infant mortality. We know that paid family and medical leave combats poverty, gives children a healthy start, and lowers the wage gap between women and men by providing structural support to balance work and family. In addition, we need more maternal mental health resources. We have many maternal mental health deserts. About 84% of birthing aged women live in maternal mental health professional shortage areas. And it's unbelievable because maternal mental health or perinatal mental health disorders are the most common complication of pregnancy and birth. Of course, we need a full range of reproductive health care for all, including abortion. Childcare supports. Last year we had a Moms Rising member, Callie, in Washington State, who said she paid $60,000, over $60,000 for childcare. Okay. And in a pro-family society, all families would have access to affordable, high quality early care and education opportunities. Another thing that's super important is food and nutrition assistance. The budget reconciliation law, excuse me, passed last summer by Republicans and signed into law, cut SNAP, or also known as food stamps or EBT, by $187 billion, which is the largest cut ever to the country's first line of defense against hunger. So that is criminal, in my opinion. We need expanded Medicaid access as well. We know that Medicaid expansion is tied to reduced maternal mortality and healthier moms and babies. And last, I'll say we need expanded midwifery care access. We have many maternity care deserts. Those are counties where there is no access to birthing hospitals, birth centers offering obstetric care, or obstetric providers. Over 35%, over a third of US counties are considered maternity care deserts. So we need more options in this regard. There are way too many restrictions and obstacles in the United States to providing and accessing midwifery care. And, according to the World Health Organization, the US ranks 55th in the world for maternal mortality outcomes. So one thing that we do know is that countries with excellent perinatal outcomes all have a much larger midwifery workforce. They have paid parental leave. They have extended postpartum care when you compare them to the United States.
Thank you so much for walking us through those steps that could be taken to improve uh, the healthcare of families everywhere. It's really important. And thank you so much for taking the time out as well to share your expertise. So with that, I'm going to go into a couple of next steps before we get to the Q&A. So you can plug into ReproAction campaigns at reproaction.org, or you can find us on social media at ReproAction. And stay tuned for any future webinars that we have by signing up for our email alerts. And you can do that on our website. So for the Q&A section, I have a question, and I'm going to direct this towards Jasmine. I couldn't find anything, but it is a question about um, forced C-sections, as we had discussed the recent story about two women in prison. Have we seen any cases like that come out of Missouri specifically?
Um, Not that I have seen. Um, yeah, not that I have seen. I have not been following that aspect of this too closely.
Got it. Just checking. Thank you. And then my next question, I'm going to kick it over to Jory, and that is, what are some policy actions? Gina had given us a few different examples, but do you have anything additional about policy actions that could improve equitable access to fertility care specifically?
I do, yes, and I think I'm reading a question in the chat, so maybe it will touch on that too. But yeah, so I think, right, when we're talking about uh, people being able to access fertility care, including IVF, fertility preservation, IUI, all of it, right? We have to think about how do we actually make sure people have access. And right now, because cost and out-of-pocket cost is such a barrier, and as I mentioned, fertility care is part of healthcare. We really should be looking and fighting and encouraging states to mandate insurance coverage and provide folks with insurance coverage so that people are able to access fertility care. And we talked about how right now across the country, it's a patchwork framework, and where there are mandates, they're not great. So we really need to make sure that fertility insurance mandates are inclusive. So they include, heterosexual couples who are experiencing infertility, but they also include single individuals, LGBTQ folks, people who need fertility preservation, whether it's because they are undergoing treatment for cancer or a different diagnosis that impacts infertility, but also people who might, want to delay family building. We want to make sure that everyone who needs fertility care is able to access care so that laws are written in such a way that they're inclusive. We want to also make sure that fertility insurance laws are comprehensive so that they do cover the full range of fertility care. So that includes fertility preservation and IVF, and that they, contemplate that, some fertility care can be done in a lab clinic, but some can be done at home, right? Some people prefer to build their families at home, and there are fertility care processes that can do that in what some people feel is a more accessible, dignified way to have, a family member or a midwife help them with, IUI or artificial insemination, as some states call it. And then we also want to make sure that policies are equitable. So I talked about how everybody leaves public insurance out of the conversation. We need to not only get fertility coverage on private insurance plans, but also public insurance plans. And just a note, if you are in a state, I know there's a question in the chat, but if you do have questions about getting access, whether it's fertility preservation or IVF coverage, and using legislation to mandate IVF coverage, the center can help do so depending on what state. So feel free to reach out to the center. Happy to come in and help provide legal guidance on getting a legislative, support and fix at the state level.
Great. Thank you so much. With that, we are at the top of the hour. So I just want to take a second to say thank you so much to our panelists for sharing your expertise today. To our audience, please check out their websites and resources that we've discussed. And thank you for attending. And thank you so much to Jasmine for putting together this month's webinar. Take care.